We call ourselves Cervic and operate under our SEC name Cervic Med Corp with office and clinic located at Fed Del Mundo Medical Arts Building in Banawe, Quezon City. We are a social enterprise aimed to help in the elimination of cervical cancer in the Philippines. As you know, cervical cancer is the second most common cancer in women in the Philippines, and about 11 die from it each day. The elimination is based on the World Health Organization Global Strategy, the 90-70-90 protocol. Why is the incidence of cervical cancer high in the Philippines? One cause could be the low attendance of cervical screening as reported by the WHO survey, a dismal 7.7% of the total women population. Another could be the general lack of cervical cancer awareness, low patient compliance and follow-up, and the lack of screening facilities, expertise, and treatment facilities, most especially in the rural areas. Another could be because cervical precancer and early cervical lesions are asymptomatic, that women do not go to doctors for checkup. Most await for symptoms to appear, and by then it's already too late. You can see this happening in a study by Domingo et al. The percentage of cervical cancer patients seeking consult at the PGH were found to be in the stage 3 in 52% and stage 2 in 25%. The 5-year survival rate for these women are 30% and 60% respectively. This is why 1 in every 2 women diagnosed to have cervical cancer will die in the next 5 years. To help in the elimination of cervical cancer, now Cervic focuses on the delivery of cervical awareness, cervical screening, and delivery to the treatment to both private and marginalized communities and in areas where there are less doctors. Here are some of the awareness campaigns we delivered and plan to deliver within the year. To date, we have delivered some 16 webinars since our inception in December 2019 to non-governmental organizations such as Rotary, Inner Wheel, Soroptimist, YWCA, and others, and local government units. We have initiated a hand sign, a hand gesture aimed to instigate to women, a reminder to get cervical screening. We now have influencers such as actors and actresses signifying their support to Cervic and by doing this hand sign. In the later months, we will launch the SOCMed 365. This is a social media campaign where we will post one question and answer video every day for 365 days that is verbalized by different NGO or LGU leaders and other influencers, answers to common cervical cancer questions. We are now supporting the World Health Organization Glow Teal campaign, the lighting of monuments and iconic places in the color of teal, as teal is the color of cervical cancer elimination. We have started an online platform since December 2020, a Facebook Live and a YouTube channel called Cervic TV that talks on cervical cancer, shown every Sunday at 1 to 2:30 p.m. We are now getting hits of followers, and companies have signified their interest in partnering with us and coming out with shows under our wing in our support for our cause and the promotion of their company alongside ours. Lastly, we partnered with the WHO cervical cancer advocate and survivor, Ms. Karen Nakawala from Zambia, to come up with a global cervical cancer support group called Teal Sisters or Teal Sisters Philippine branch. Wherever we do our cervical screening during cervical missions, we conduct a pre-questionnaire initially to understand patients' CAP or knowledge, attitude, and practices. We then ask patients to watch a video on cervical cancer for them to understand the importance of cervical HPV vaccines and screening. We then do a post-intervention questionnaire to check how we can improve more our services. Our cervical screening is done with the aid of a colposcope. The procedure is called visual inspection with acetic acid aided by magnification of a colposcope, which we call via colposcopy. Images are taken by the colposcope and are sent abroad for artificial intelligence reading for immediate interpretation. The results you can get within 5 minutes using AI, with an accuracy reported to be at 93% sensitivity and 89% specificity. In cases of private patient, these reports can be sent to doctors remotely, accessed anywhere, anytime. Doctors can now provide their final diagnosis based on the colposcopic images taken by the nurse or midwife remotely, with the AI serving as a guide. But for cervical cancer screening missions, the artificial intelligence reads will be good enough. We serve our private patients for now at the Fidel Mundo Medical Arts Building in our office and clinic. Treatment of cervical cancer depends on the presentation of the disease. For VF-positive patients during screening missions, we can treat them directly using cryotherapy or do a colposcopy-guided biopsy and refer them to subspecialty doctors for appropriate action. Lastly, Cervic can contribute its data to the 2 Philippine cancer registries in the country. Remember that our current cancer registry unfortunately covers only the areas of the NCR and Rizal. While we do our cervical cancer screening nationwide, our data can provide additional value information to these institutions.